For the surgeon that's treating sleep apnea patients, I think an important tool or procedure to have available is the hyoid suspension. It's a newer procedure. It's more specific to the tongue base. If we're concerned about tissue removal, that's important if there's excessive amount of tissue removal. But for many patients, just opening up the inferior aspect of the hypopharynx, the base of tongue area, then the hyoid suspension is something you need to have available to offer many patients, potentially all patients, depending on the severity of their apnea. I look at hyoid, adding that to my practice. It's one of the newer procedures I've had possibly in the last 8 years, but I'm using it on almost all patients that are severe. Now, for mild to moderate patients, I don't always use the hyoid suspension. It depends on their anatomy and tissues that we may want to remove in the upper airway. But the hyoid, again, is focused on the tongue base to help that patient that over time their muscles have relaxed and tissues are falling, especially the tongue base or the tongue falling back in the throat to close off the airway. The hyoid suspension helps us to reposition the tongue a little bit forward and suspend it when they relax so it doesn't close off and shut off the airflow. The hyoid suspension isn't a standalone procedure. We can't say that that's how we're going to treat someone if they've never had any surgery. On the other side of the coin, if you don't have the ability to use the hyoid suspension with your treatment of a sleep apnea patient, you may be missing out. Because I have found in my practice that the hyoid suspension gives us an additional 20% reduction in the apnea-hypopnea index. So each patient that we see is unique. They may have already had procedures performed in the past, and hyoid suspension wasn't around or wasn't offered at the time that they had their surgery, so that would be an excellent addition. Possibly even pillar implants with a sleep apnea patient towards the end of their treatment. If we've improved them dramatically, that might be an additional approach to help the sleep apnea patient to reduce them another 10% potentially in their amount of obstructions. With the hyoid suspension, again, if a patient has had traditional surgery, we may want to focus more on the tongue base. And so doing the hyoid suspension, which is external approach, and then maybe something addition to the tongue base, reducing the lingual tonsillar tissue with a laser or with radiofrequency. That combination can be a nice addition to a patient that's already been treated traditionally.